Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Dr. Eric Osansky, who's a chiropractor, clinical nutritionist, and a certified functional medicine practitioner who helps people recover from thyroid and autoimmune thyroid conditions. He's the author of the books Natural Treatment Solutions for Hyperthyroidism and Graves' Disease and Hashimoto's Triggers, and is the host of the Save My Thyroid podcast. Dr. Osansky was personally diagnosed in 2008 with Graves' disease, and after taking a natural treatment approach, has been in remission since 2009. After seeing how well natural treatment methods helped with his condition, he began using these natural thyroid treatment protocols to help others with different types of thyroid and autoimmune thyroid conditions, including hyperthyroidism and Graves' disease, and hypothyroidism and Hashimoto's thyroiditis. Welcome to the show, Dr. Osansky.
Yeah, thanks, Dr. Stephanie. Appreciate you having me and excited to be here.
Well, tell us your backstory. I don't know too many people with hyperthyroidism. So how did you become such a specialist in these conditions? And tell us your story about Graves' disease.
Yeah, so in 2008 is when I began my hyperthyroid Graves' disease journey. And so, one day I was walking around a Sam's Club and, they had one of those automated blood pressure machines. And, I decided to take my blood pressure. My blood pressure was fine, but my resting heart rate was elevated. And at the time, I wasn't sure. Maybe it was because I was walking around a Sam's Club. But, the next few days, I took my resting heart rate and it remained elevated.
Like how high are we talking here?
Anywhere between like 90 and 110 beats per minute.
Okay.
So yeah, it wasn't like crazy high. Some people have it like 140, 150 beats per minute, but still for me, that was high. Usually it was like in the mid 60s, like a high would be like lower 70s. So something definitely was not right. And so what I skipped over was prior to that, a few months before, I was exercising. Well, I was always exercising, but I was dieting and detoxifying and probably doing more exercising than I usually did. And just because a few months prior I was a little bit in the weight department, a little bit more than I wanted to be. So I was trying to lose weight, trying to, live a healthier lifestyle. But, so I was losing weight, had increased appetite. I did have some of the signs and symptoms of hyperthyroidism, but I attributed it to, the exercising and weight and the detoxifying and the strict diet. And so it wasn't until I had the elevated heart rate when, I was like, okay, something else is going on. And then shortly after that, went to a primary care doctor, got diagnosed with hyperthyroidism. And then after that, I went to an endocrinologist who tested me for Graves, did the antibody test for Graves and, tested positive for that, did an ultrasound as well, which that actually looked good. But yeah, at the time, I didn't know much about hyperthyroidism and Graves' disease. But one thing I did know was I was going to take a natural approach. And the reason for that, not just my background being a chiropractor, but even though I'm a chiropractor, when I went through when I was practicing chiropractic, which, right now I'm just focusing on the functional medicine side of things. But back then, my continuing education credits, I always would take nutritional courses. And I actually attended a few functional endocrinology courses where they spoke about treating thyroid conditions naturally. And so, I didn't know if I would be successful in doing that, but I'm like, but I knew I didn't want to take the conventional approach, at least initially. I figured, well, if I could always start out by following a natural treatment protocol or not natural treatment methods. And, sure enough, I did. I changed my diet, did things to manage stress. I mean, we could talk more about these things, took certain supplements and did other things. And got myself into remission and been in remission since 2009. And ever since then, I've been helping other people with not only hyperthyroidism, Graves' disease, but as you mentioned, those with hypothyroidism, Hashimoto's.
Congratulations. That's awesome. I want to go back to your story though. So when you were having these symptoms and you went to your primary care, did he or she just start with the TSH, or what labs did that provider run?
No, I'm pretty sure they did a full thyroid panel. I know especially with hypothyroidism, Hashimoto's, a lot of times they'll just do a TSH. But in this case, and even in some primary care doctors, even if they suspect hyperthyroidism, they might just do honestly, Honestly, I'm not sure. They might have not done a free T3. They might have just done a TS. It was, again, quite a while ago.
Sure.
They might, but they did not just the TSH. I'm pretty sure they did at least a free T4 and the TSH. And yeah, so, but they didn't do that. That's the extent of it. If they did T3, that's all they did. They didn't do antibodies. It wasn't until I went to the endocrinologist that they did that.
Sure. Well, let's kind of discuss the difference, and then maybe you can also tell us what you found with your labs, but kind of as far as antibodies go. But what's the difference between hyperthyroidism, so Graves' disease, and then hypothyroidism or Hashimoto's? What's the difference for our listeners? We've talked a lot about low thyroid on this podcast, but not a lot about high thyroid.
Yeah,
Kind of just answered that question. You answered that question.
Yeah, well, so as you said, like hyperthyroidism, you have elevated thyroid hormone levels, and you mentioned TSH. So TSH is thyroid stimulating hormone, which is a pituitary hormone. And so you spoke a lot about hypothyroidism because it's a lot more common. And so when someone has lower thyroid hormone levels, which is what hypothyroidism is, sometimes it's many times actually subclinical hypothyroidism, where it might be on the lower side, but within the lab reference range, but not within the optimal range. But either way, when you don't have enough thyroid hormone, the TSH signals to the thyroid to produce more thyroid hormone. So you want more of that TSH, more of that signal to tell the thyroid gland, okay, we need more thyroid hormone here. With hyperthyroidism, it's the opposite. Since you have too much, the pituitary wants to slow things down. And I should mention, the hypothalamus communicates with the pituitary. So it's not just the pituitary. And so, but yeah, so you have lower TSH levels, usually depressed TSH levels. You might see it on the lab like as less than 0.001, or some will say less than 0.005. But it's undetectable because, again, it's trying to stop the production of the thyroid hormone. So from a blood test standpoint, what you would see, again, elevated thyroid hormone levels with hyperthyroidism and a depressed TSH, whereas with hypothyroidism, you would see elevated TSH with lower thyroid hormone levels. And with regards to the symptoms, if someone has lower thyroid hormone levels, then that slows things down. So as you mentioned, I'm sure you discussed during your podcast some of the different symptoms with hypothyroidism. So fatigue, brain fog, coldness, sometimes constipation. Those are, there's others, but those are some of the more common ones. And
everything slows down: hair growth, metabolism, nail growth, bowels, brain, right? Everything slows down with low thyroid as compared to what you're about to say with high
hyperthyroidism. Yeah. Where it speeds up. Yeah. So when I dealt with hyperthyroidism, Graves' disease, I mentioned how I had an elevated resting heart rate, also had palpitations, had some tremors. And, I mentioned the weight loss. Now, it's a little bit tricky because not everybody with hyperthyroidism loses weight. Some people gain weight. Sometimes it's due to the medication, because if you take anti-thyroid medication, that could cause you to gain weight. But it's weird. Sometimes people, even without taking that, they're actually gaining weight. Then some people will get frustrated. They're not happy if they had hyperthyroidism, but they'll be like, yeah, I wish I would have at least lost some weight, since they look at the symptoms. But the classic symptom is weight loss and, increased appetite. Also, I had sometimes looser stools and, sometimes even diarrhea. Anxiety is quite common. Insomnia is quite common. So yeah, those are, and, hair loss, you could, mention when hypothyroidism, like it affects like the growth of the hair and nails, even though, again, you could have hair loss also with hypothyroidism. Hashimoto's, definitely see a lot of hair loss in my hyperthyroid patients as well.
Do we know how common hyperthyroidism is? We know that hypothyroidism is very common, but how common is hyper? Do we know any statistics on that?
Yeah, so it's a little bit in the United States, a little bit less. The prevalence, like I think it's like 0.8%.
Oh, wow.
If I'm remembering that. And then in Europe, for some reason, it's a little bit higher. I think it's like 1.3% of the population.
So significantly less common than hypothyroid.
Correct. Yeah.
So why do you think people develop? Well, actually, let me go back. I want to go back to antibodies. So what's the commonality with hypo and hyperthyroidism in regards to labs? Like, you went to the endocrinologist and they found elevated antibodies. So again, I'm not doing a very good job here because I'm like answering the questions I'm asking, but I was going to ask, what's the commonality with the labs, meaning, with autoimmune conditions, essentially you can have elevated antibodies with both low and high. So in your situation, it sounds like you did have elevated antibodies. Are you comfortable sharing like which ones were elevated, how high they were, kind of that journey you've been on?
Yeah, of course. So yeah, so there are different types of antibodies associated with different autoimmune conditions. So you're absolutely right. With both Hashimoto's and Graves, you have elevated antibodies. So the antibodies associated with Graves are thyroid stimulating immunoglobulins, also known as TSI. It's a type of TSH receptor antibody. So some practitioners will test TRAB. Usually I just stick with the TSI. That's the more specific one. And, I just don't see the purpose of testing both of those. And some will do that. But before I get to like my experience, as far as, what I tested positive for, I'll mention the other two antibodies, and that's thyroid peroxidase antibodies, TPO antibodies, which are more commonly associated with Hashimoto's, but a lot of people with Graves have them too. The literature, depending on the source, will say anywhere between 60 and 80% of people with Graves will have those antibodies, more common like 90% in those with Hashimoto's. And then there's the anti-thyroglobulin antibodies, which are more specific to Hashimoto's. And, I see different combinations in my practice. So I see a lot of people with elevated TSI and elevated TPO. I see some people that have all three antibodies. And then, of course, with Hashimoto's, usually just going to see the TPO and the thyroglobulin. So in my experience, when I dealt with Graves, the only thing that was positive was TSI. I did have TPO antibodies that were negative, and I had the anti-thyroglobulin antibodies tested. They were negative. And, as far as high, I will say they've changed the ranges in some labs. So like when I got the TSI, it was more of a percentage. And and that's changed, at least when it comes to, I believe, LabCorp and like Quest Diagnostics. Some other labs still use that percentage. And so my antibodies were, like around the 230, 240 range, which is, clearly elevated. You ideally want it, depends on the lab. Some will say below 140, some will say below 120. I would say extremely high is like greater than like 300, 400. And what's significant about that is that the higher the antibodies, it doesn't necessarily mean the worse the person will be. Like I've seen people with lower antibody levels with elevated thyroid hormone levels, like really high thyroid hormone levels, and the vice versa, where someone has really high antibody levels and their thyroid hormone levels are not as high. And it doesn't always correlate with the symptoms, but what it does seem to correlate with the antibodies is the incidence of what's called Graves' ophthalmopathy or thyroid eye disease. So a good amount of people, again, thankfully I did not deal with thyroid eye disease, but a lot of my patients have. And usually the higher the antibody level, the greater the risk of developing thyroid eye disease. Doesn't mean you will develop thyroid eye disease, and then like I mentioned, the labs are different. So they use, I forget the actual units that they use, but for example, most labs, it will be like less than 0.55. And so again, if someone here is like, mine was like, in the 230s, again, that wouldn't be the case now. Like it would usually, like a real high number, would be like in double digits, like 10 or greater. I mean, I've seen people like well over that, but again, so it's hard to compare. And I haven't found any way to convert the two values. So there are still labs that use the percentage and some use the newer reference range. And it's a little frustrating because some people will come in and they'll have, like a year's worth of antibodies, but they might be going back and forth, and you can't really tell like what's going on as far as if there's any change, I guess. I mean, obviously, if they're elevated, and in the presence of hyperthyroidism and those elevated antibodies, it's diagnostic of Graves, regardless of how high they are. If they're even mildly high, you're still considered to have Graves.
Sure. Let's go back to antibodies. So does the elevated antibodies suggest autoimmune thyroid disease for the listeners?
So Yeah, I mean the elevated autoimmune I mean and I'm sure you know this. I mean the antibodies come first before the
Mhm.
thyroid gets out of range. So there's like an autoimmunity timeline, and not just with thyroid antibodies, but with other antibodies. So there's
Mhm.
certain factors that cause autoimmunity to develop, triggers and having an increase in intestinal permeability. There's some genetics too, and increased intestinal permeability, medical term for a leaky gut. But
Yes.
yeah, so those antibodies, again, they develop. Yeah, they take years to develop. The thing is that most doctors won't test the antibodies first. Or, as you mentioned earlier, usually what happens is someone might be not feeling well, especially with hypothyroidism. Like they might have fatigue and low energy, gaining weight, but they might dismiss this as being, thyroid, not even thinking about thyroid. And, the doctor will run a TSH, maybe because the person's complaining, maybe just as part of a physical, and then maybe see that that's elevated. And then maybe they'll test the antibodies. Not all doctors will even do that. But even if you see those antibodies, they probably been elevated for quite some
Mhm.
time, many times years. But from a medical perspective, like a conventional medical doctor, if they just see elevated autoantibodies by itself and everything looks good, they probably wouldn't say it's autoimmunity, until everything, like, you can't, again, like Graves' disease is not diagnosed until the thyroid is out of range along with the antibodies, and same with Hashimoto's. If someone just were to have elevated TPO and or anti-thyroid globulin antibodies, and if the thyroid looked fine, at least from a lab reference range, again, from a diagnostic standpoint, they probably wouldn't diagnose a person with autoimmunity. But to me, there's definitely like an autoimmune process going on there.
I agree. Yep. So I tell patients, like you were saying, TSH is more of the brain hormone, then T4 and T3 are more the thyroid hormones. And then when antibodies are elevated, those are more looking at the immune system, right? So if you have thyroid peroxidase antibody elevation, thyroid peroxidase enzyme is leaking out of your thyroid, and your immune system is now creating antibodies, essentially attacking that. So those are the immune markers that, definitely to me suggest that there's an autoimmune condition brewing here. So let's go back to what you just said as far as diving into why people develop the autoimmune conditions. I know, let's spend some time here. You kind of rattled off a list of various things, but let's go back to that.
Sure. So yeah, so there's something called triad of autoimmunity, also known as the three-legged stool of autoimmunity. So one of those factors is a genetic predisposition, and that's why I use the word remission. Like, some people might wonder, well, why don't I just say I'm cured of Graves? Because since 2009, I haven't had hyperthyroidism. My antibodies have been normal. So, like, and again, I feel like I'm cured. I've had some scares along the way. I've had chronic Lyme disease, and I've had shingles and other things that, I thought might re-trigger the Graves, but thankfully didn't. And, but because of that genetic predisposition, I'm always aware that it could come back, if I don't maintain my health. And we could even talk more about that. But so the genetic predisposition, second factor, exposure to one or more environmental triggers. And there's different triggers. I mean, I go into great detail in my book, Hashimoto's triggers, but I could talk about some, like, there's four main categories of triggers I chat about. One is food, such as gluten, dairy, corn, salt. And this is according to the research. This is me just like throwing things out. Salt, too much salt, like, can increase Th17 cells, which are associated with autoimmunity. I recommend sea salt to my patients. I don't tell people like avoid the salt, but if you're eating a lot of processed foods, I mean,
Sure.
the salt, the sodium will add up, and that could be at least a contributing factor, if not a trigger. And then the second category of trigger, stress, and it could be emotional stressors, it could be physical stressors. So one thing I mentioned is, I was exercising, I was dieting, detoxifying, but when it comes to exercising prior to my development of Graves, or at least prior to the diagnosis of Graves, I was overtraining. I'm pretty sure I
Mm,
was overtraining and putting a lot of stress on my body. So there was definitely emotional stressors too. Even though I was in denial, I was thinking, oh yeah, I know there's stress, but I was doing a good job of managing the stress until I looked at, and I did an adrenal saliva test and saw how bad everything looked, and that made me realize that the stress was impacting me. But again, both physical stressors, emotional stressors. could have an impact and could be a trigger causing dysregulation of the immune system or affecting the body in other ways, increasing, contributing to that increase in intestinal permeability, that leaky gut, which is that third component, which we'll talk about shortly. But third main trigger, chemicals. We live in a toxic world, and it's not getting better, unfortunately. There's heavy metals, there's xenoestrogens. I mean, there's so many different things we're exposed to, and there's only so much we could do outside of the home, which is why you want to do as much as you can inside of your home, eating organic food, drinking purified water, using natural cleaners, cosmetics. And again, once you step outside, again, just really not a whole lot you could do. I mean, you could, change, like, again, if someone's if their home is like right on a highway, obviously it's not easy to move, but you got to consider things like that, like the location of where you live could also. So when you step outside, if you're in a more toxic environments, that's going to take its toll, and you might not be in a position to move tomorrow or next week or next month. But again, if you're in a toxic and again, it's like a no-win situation, because you go out to the middle of nowhere and they might be spraying, with the farms and all that. So again, but still, some places arguably are worse than others. And then the fourth category of triggers, infections. And this can include gut infections, things, parasites, H. pylori, could include viruses, such as Epstein-Barr, the most recent virus, we've been dealing with. And, I mentioned chronic Lyme disease is something I dealt with, and it didn't re-trigger it in my case, but can be a trigger of autoimmunity, Bartonella. And so those are the four main categories of triggers. And like nutrient deficiency, some will say is a trigger. To me, it's more of like an underlying imbalance, like a contributing factor. And then that third component of the triad of autoimmunity, that increase in intestinal permeability, that leaky gut. And so that is another factor. And, these days, a lot of people do things to heal the gut, which I think is great, but you need to remove the factor that's causing a leaky gut in the first place. So if it's gluten, and if all you do is drink bone broth or take L-glutamine, it's probably not going to help much until you remove the gluten. If you have a gut infection, you need to remove the gut infection. But that's really that triad of autoimmunity, that three-legged stool, is really, how autoimmunity develops.
That was good. Thank you. So is there a specific diet that you recommend for patients with Graves or Hashimoto's?
So before answering that question, I'll say there's no perfect diet that fits everyone, and you're aware of that. So I think a lot of practitioners, including myself, we have our favorite diets just because we see results. Like I think what we all have in common as functional medicine practitioners is we want people to eat whole, healthy foods, avoid refined foods and sugars, the common allergens, make sure you avoid those, unhealthy oils. Yeah, and then, like, should someone follow a paleo diet or carnivore diet or vegan diet or, autoimmune paleo diet or low FODMAP diet? I mean, there's so many different diets out there. I do like autoimmune protocol, the AIP diet. And to me, it's a starting point.
Sure.
So it doesn't mean that it's a permanent diet, but it also serves as a good elimination diet, because you're eliminating the common allergens, you're eliminating foods that could be harsh on the gut. There are people I work with who, I mean, I don't think anybody truly wants to do it. Like, no, I don't think people look forward to it, but there are people like, I don't know if I could do it. And I mean, I didn't know if I could do, as far as when I was dealt with Graves, the diet part, I didn't know if I could, clean up my diet. And back then there wasn't AIP. So I honestly started out with more like a regular paleo diet. And even that at the time was hard. Now it's what I follow. I follow more of a regular or kind of like a modified paleo diet these days. So, but yeah, if someone absolutely is like, oh, I just can't follow AIP, again, paleo is a pretty good diet as well. If someone's a vegan, vegetarian, it's going to be very difficult to follow AIP, and even maybe paleo to some extent. So we might need to make some modifications. And so, yeah, so again, AIP is a starting point for a lot of my patients, but it depends on the person. And, it depends. I mean, if we're talking about Graves and Hashimoto's, those are autoimmune conditions. If someone comes in with like, if I work with someone who has a non-autoimmune hyperthyroid condition, for example, or I guess even non-autoimmune hypothyroid, then again, maybe just a paleo diet would be fine for them. So it is to some extent individualized, but like I said, a good starting point for me, or for the people I work with, is an AIP, elimination type diet.
I've had some patients try to barter with me, like who have autoimmune conditions, because they love their gluten or they love their dairy or whatnot. Do you let patients barter with you? Do you run food sensitivity testing? Like, so if someone had an autoimmune thyroid condition and gluten didn't show up on their food test, would you still recommend they avoid gluten? I can tell you, I would tell them yes, because I don't think gluten helps anything. But what's your opinion on that? How would you approach that?
Yeah, no, it's ultimately up to the person, but there's no negotiating. Like you're not going to get permission from me to eat gluten or dairy. So I can't follow the person around. But so I take a similar approach. It's, this is like, if someone absolutely cannot give up the coffee, because I usually will recommend give up the caffeine, that I think is a little bit negotiable. Like if someone's drinking like 3-4 cups of coffee a day and they're like, oh, I'm down to 1 cup a day, okay, that you might still be okay with the coffee. I mean, I still prefer for people to completely eliminate it while restoring their health. But there are some health benefits to coffee, and everybody's different. Some people are, fast metabolizers of coffee, you might do fine. Some people, their adrenals aren't as bad. But yeah, gluten, if they're, I don't sell, if someone says, oh, can I have like gluten every now and then, or, just like once a week or once a month, I tell them that, like everybody's different. And some people, even if they have it once in a while, it can cause inflammation and set them back. So, I don't want to, my goal is not to be mean to anybody. That's not the reason behind the diet. It's just that I don't want someone to be working with me for a few months, not be improving.
Right.
And then we say at that point, oh, well, you've only been 95% gluten-free. Maybe, if you were 100% gluten-free, you would be receiving the results you'd want to receive. And, to be fair, diet's not the only answer. So someone could be 100% gluten-free, 100% dairy-free, and not receiving good results. But at least I could say, all right, we know for sure it's not the gluten. We know it's not the dairy, where someone is straying from the diet. We have no idea. Is it something else, or is it because you're straying? So either way, I definitely recommend for people to be strict with those.
Yep. Agreed. Okay, let's talk about iodine. So I want to know, of course, I'll voice my opinion here first, but I want to know if you feel like iodine is beneficial or harmful to those with thyroid conditions. Because personally, I've seen it help some cases, hurt other cases. And interestingly, about a year ago, I interviewed Alan Christensen, whose episode launched as part of Thyroid Awareness Month, which I think is February.
No, it's actually this month.
Is it January?
It's actually January.
Okay.
Yes.
And he is very, I don't want to say anti, but he definitely recommends one monitor and limit their iodine consumption. And I know there are differences in opinions on this. So do you feel like iodine's beneficial or harmful to thyroid, specifically autoimmune thyroid conditions, I should say?
Yeah, a common question. And I did read Dr. Christensen's book as well, the Thyroid Reset Diet. So, and, it's funny because things definitely have changed over the years as far as our perspective of iodine. So when I dealt with Graves, again, 2008, a lot of practitioners were recommending high dose iodine. And when I went to, those conferences I mentioned to learn about, like functional endocrinology, they were definitely in favor of iodine. So iodine at the time was actually part of my protocol. And, so I was one of the people that did well with iodine. And so as a result, after that, for at least the first few years, I would be like, okay, everybody's getting a urinary iodine test, and then most people are deficient. So you're going to be on, not only iodine, but like higher dose iodine. I read Dr. David Brownstein's book years ago. Yeah. And so I was a believer that everybody needed iodine, but like you, then I started seeing, I saw people who didn't do well with iodine, and then more research came out. Dr. Tatis Karazian is one that, really like is, I won't say anti-iodine, but just educated practitioners about, the risk associated with iodine. And, so my perspective, it definitely has changed, but I'm not anti-iodine. I think, like, So I don't know if like someone needs to be like consuming less than 200 micrograms of iodine or 200 micrograms or less, which is what, Dr. Christensen says. I think it does depend on the person. But that being said, I am cautious about having people take separate iodine supplements. So I definitely don't take the same approach where like iodine testing is not part of my current
Regimen.
routine.
Yeah.
And whereas so any mineral deficiency needs to eventually be corrected, but I don't think it's like it's essential, like taking iodine. And again, it can potentially exacerbate the autoimmune response, be a potential trigger. And I actually talk about that in Hashimoto's Triggers, my book. There's a chapter dedicated to iodine. So whereas in my book, Natural Treatment Solutions for Hyperthyroidism and Graves, I really didn't say, at least I don't think I said too many things that were negative about iodine. When I wrote the book Hashimoto's Triggers, that was years later. More research had come out, and again, I labeled it as a trigger. It's not a trigger in everybody, but it could be. And like another example, if someone's taking a multivitamin, I honestly won't recommend a iodine-free multivitamin. I don't
Yeah, me
usually. I
either.
don't. Yeah, I don't see. I think the opposite could be harmful too, like trying to really restrict all iodine from your diet. So to me, it's like, if you take a multivitamin with iodine, usually I'll have like 75 to 150 micrograms. And, if you're eating some other foods that have iodine, that's usually fine. If someone's eating, like, sea vegetables, then I might be like, like you're eating seaweed and kelp, that's higher amounts of iodine, then I might be more cautious. But if someone's eating eggs, which isn't part of a AIP diet, but it's part of a paleo diet, I'm not going to tell the person not to eat eggs because there's iodine in the eggs. And,
Yep.
and I haven't seen problems, at least not with the eggs from an iodine standpoint, or at least I don't think it's an iodine standpoint when someone has an issue with eggs. It's usually, a sensitivity or something, something like that. But yeah, it is complex with iodine. I would say I'm more pro iodine, meaning that I'm not like, everybody has to completely eliminate iodine, from all their supplements, like multivitamins in their food. But I am cautious with iodine because like you, I've seen people, I've had, I remember someone reached out, it wasn't a patient, but someone reached out to me and they, on their own, not through my recommendations, like they supplemented with iodine and they developed like thyroid eye disease. They at least if they had it was mild. And I remember the email, this was years ago, just saying how it now like their eyes are inflamed. And just so I mean, it's scary enough when someone isn't symptomatic, but then you do a retest and it like spikes up their TPO antibodies. And especially if that's the only thing they did was just take iodine. Anyway, so again, like I said, I'm
Cautious.
not against iodine, but cautious. Yeah.
I would say that that's my current stance too. So I used to use more iodine, again, because I see more low thyroid cases. And I thought, well, if iodine's a building block for T3 and T4, these patients must need some of it. And on their urine iodine excretion test, they'd be low. So, I would use some of it. I got to kind of more liberal use of it, I'd say. And then I started to experience some challenges with my patients. And they too sometimes would put themselves on very high dosages. And I saw two things. I saw elevated TPO antibodies, not in everybody, like you're saying, but some people would see the spike. And clearly in those patients, I'd say, oh, let's get rid of the iodine. And antibodies would usually go down. And I also have seen elevated TSH, just not correlate with T3 and T4, but just incidental TSH spikes with iodine use. I had some patients actually put themselves into hyperthyroid crises. A couple landed in the emergency room at one point, not at my advice, but they themselves just were taking, high dose iodine, and it really backfired. It actually caused hyperthyroidism. And then over the next several months, getting them off the iodine, we tracked their levels and they became normal again. So I've seen it go both ways. I've seen it help and I've seen it hurt. And so I'm also very cautious. But what I found super interesting about Dr. Allen's book was that he's saying, could it be, he was kind of proposing, could it be that when patients go gluten and dairy free, it's not just that they're removing inflammatory foods, they're reducing their iodine. And I had just never thought of that before. And so maybe that's part of why patients tend to do better also when they're on, anti-inflammatory eating, they're lessening their iodine. But I think that's a complex, topic that we can't break down in, 5 minutes on the podcast. But it sounds like we're very much in the same boat. We're just cautious with its use, because I think some people need a little bit and some people overdo it. So we need to monitor labs and track patients and their symptoms to determine who should be taking it. Yeah.
Yep, definitely agree.
What about goitrogenic foods? So a lot of patients, we have a hormone clinic. We use a lot of DIM, which is an extract from cruciferous vegetables, putting a lot of my patients, females and males, on it. And they always say, oh, I can't take that. It'll impact my thyroid negatively. And I'm already borderline, whatnot. So, and usually I say, you're fine, you can take the DIM, but what's your opinion on any kind of concerns with goitrogenic foods for thyroid conditions?
Yeah. So again, for those who are unfamiliar with goitrogens, they, as far as food-based, like cruciferous vegetables, considered goitrogenic, so they could potentially, speaking of iodine, inhibit the uptake of iodine, potentially inhibit thyroid function. And so some are concerned because there are some studies in rodents. I'm pretty sure there are still no human studies out there, but large, and even in the rodents, it was larger amounts of the cruciferous that caused, like goiters. And so I really haven't seen that in my patients. I can't say there's no exceptions, like where, I've had maybe over the years, where I could count on my hand, the number of people who said, oh yeah, I've been eating broccoli and I feel that my thyroid is swelling. And it's like, well, maybe maybe in your case, it's goitrogenic, and, listen to your body. I would never tell someone to keep on doing something,
Right.
if something like that's happening. But an interesting story is, so I deal with a lot of hyperthyroid patients. And, years ago I had, one of the dilemmas with hyperthyroidism is during pregnancy, because a lot of women don't want to take the antithyroid medication. And so, like, when I dealt with Graves, I took an herb called bugleweed that it has antithyroid properties. But if someone's pregnant, there's really no research on bugleweed. So so it's
Sure.
not really indicated. So really, most women will take PTU. There's methimazole, which is the most common type of antithyroid medication, at least here in the United States. But that's also usually not given in the first trimester. So it's usually a PTU. And then they also read this potential side effects of the antithyroid meds, like causing liver problems and other things. So, they want nothing to do with it. So I actually experimented. I know this sounds scary, experimenting with, pregnant women, but it wasn't a real bad experiment. It was having them eat a lot of healthy cruciferous vegetables in an attempt to see if it would lower their thyroid hormone levels naturally. And maybe that, I can't tell them not to take the medication, but they were just doing it on their own, not taking it. I'm like, okay, let's just load up on the broccoli, the kale, the cauliflower, the Brussels sprouts.
If your
And
gut can handle it, yeah.
exactly, as long as you're not getting like all this bloating or all that. And it didn't really make much of a difference in the thyroid
Interesting.
hormone levels. So I intentionally gave people higher amounts of the cruciferous vegetables to try to have the effect that some suggest it has. And I didn't have like one person where they took it and like, oh yeah, this is actually working. So yeah, I would not be definitely not concerned about like the DIM supplements.
Yeah.
But, again, and I think the thing is also, most people are not eating too many
Raw
cruciferous vegetables as
and
well as
raw.
raw.
Yeah.
Yeah. They're cooking it. But again, the quantity, I don't know about you, but in my practice, I still have to encourage people to eat more vegetables. It's not like, hey, I'm eating too many like cruciferous vegetables. So and like you said, usually it's not like the raw cruciferous vegetables, and cooking the vegetables, as opposed to reduce the goitrogenic properties. So yeah.
Totally agreed. I want to get into different treatment options, specifically for hyperthyroidism. So maybe share with us on your journey some of the things you took. So you just mentioned, and I always get ahead of myself. I start talking and then my brain says, wait, go back. But I was going to say, you mentioned you use a bugleweed. I'd like to know some other agents you use with your patients. But I also think maybe before we get to natural treatments, we should discuss conventional treatments for hyperthyroidism. So you kind of mentioned the methimazole, whatnot. Kind of tell us how some of those medications work. So the conventional approach to hyperthyroidism, and then kind of what you did and the natural approach. Let's differentiate both of those.
Yeah, so the antithyroid drugs, methimazole, most commonly given, PTU is another one. And then in some other countries like the United Kingdom, they'll give like carbimazole, which converts into the methimazole. And they, essentially block the production of thyroid hormone, inhibit the production of thyroid hormone. And, that's obviously a good thing when you have too much thyroid hormone. The problem is side effects are common. Sometimes they'll raise liver enzymes. Sometimes they'll depress white blood cell count. So if you are on those medications, most endocrinologists will look, they'll do like a CBC with differential, a comprehensive metabolic panel. But if not, you want to make sure, that they do, because I've seen some that maybe they don't have as much experience with hyperthyroidism, with Graves, and they won't, do those tests. And then, sometimes it causes other side effects, like it might cause dizziness or rashes, and, obviously that's not fun. So yeah. So again, it's a lot of people tolerate it okay, though. Again, it sounds scary, but everything's risk versus benefits, and a lot of people do need the antithyroid meds. And not everybody I work with is on bugleweed, which we'll talk about. A lot of people are on the medication, and if it's working well, keep in mind, even the herbs that we're going to talk about, they're not addressing the cause of the problem. We just want to keep you safe while ideally trying to address the cause of the problem. So there's the antithyroid meds, there's beta blockers. So when usually with hyperthyroidism, they'll give beta blockers that inhibit the conversion of T4 to T3 as well. So the beta blocker also slows down, it affects the cardiovascular system, slows down everything, like the resting heart rate. But there's one that's commonly given called propranolol, which also inhibits conversion of T4 converts into T3. So it's inhibiting that conversion. So I'd say, I don't know percentage wise, but most of the people I work with are just on the methimazole, let's say, or antithyroid medication, other, PTU, but some people are put on both meds. And yeah, so those are the most two common medications prescribed by endocrinologists. I mean, there's others like LDN, which you're familiar with, but most endocrinologists don't give LDN for someone with hyperthyroidism. So I don't know if you want me to cover that, or if you want me to just jump into the natural agents. Or...
Yeah, this is triggering more questions. So from a conventional model standpoint, are these patients put on medication short-term or long-term? What's the expectation for some of these patients? Is it more symptom relief, like with the beta blocker, or is it, we're going to keep you on this medication until your labs normalize? Usually what's the duration of the treatment of these medications?
Yeah, so at least with the antithyroid medication, like with methimazole, and especially in the case of Graves, usually they'll put the person on for 18 to 24 months, and just hope by the end of that, the time the person will be not, so-called remission, where their numbers look good. But a lot of those people will relapse because nothing was done to address the cause of the problem. And in other types of hyperthyroid conditions, it'll vary, like subacute thyroiditis. Usually it's transient, so some people won't even be put on the antithyroid medication, because those people will a lot of times become hypo after a month or two or a few months. And then there's toxic multinodular goiter. And it depends. The person's not just going to go into remission with that, because it's involving the nodules that's involved in the production of thyroid hormone. So a lot of endocrinologists don't even want to put the person with toxic multinodular goiter on the meds. They want to just remove the thyroid, or give the radioactive iodine.
Yeah, talk about that. So how does radioactive iodine treatment work?
Yeah, no, I'm glad we got here too, because with radioactive iodine, you essentially swallowing a pill of radioactive. What happens? The thyroid gland, it uptakes the radioactive iodine, and it destroys. It essentially is damaging the cells of the thyroid gland, and so they'll use that. I mean, if I had to choose, I don't know if I'd want, again, not that surgery doesn't come with its risks, but just the thought of receiving radioactive iodine, and there are again the precautions. People when they have radioactive iodine, you're not supposed to be around your family for a certain period of time. Even sharing the toilet and things like that, you're not supposed to do. So it makes you think, well, would I want to take something like that where you're not supposed to be near people, and they quarantine you in some countries with the radioactive iodine. But essentially they're trying to damage trying to avoid the surgery. And some will think it's a safer way of just this way you don't have to do surgery, just swallow the pill, damages the thyroid gland. Again, problem is, you could have side effects, but then there are some people where it doesn't work. They'll need to get multiple rounds of radioactive iodine if they choose to do so. Some people after getting one round and it comes back, they're like, okay, I've had enough. But then there are others that'll get a second or a third round. But yeah, so I'm not the biggest fan of radioactive iodine. Again, there is a time and place for like surgery without question. So, and to me, ultimately it's up to the person. But like I said, if I had to choose between radioactive iodine surgery, I think I would probably go with the surgery. But again, the goal obviously is to try to prevent people from getting the surgery radioactive iodine, just because unfortunately, there are, over the years, I've had so many people get these treatment procedures who never tried to do anything from a natural standpoint. And, not to say the natural treatments are 100% effective. I mean, nothing's 100% effective, even again, surgery or radioactive. Well, surgery, once you remove the thyroid gland, you're not going to be hyper. But again, you could have, damage to the parathyroid glands, which, once that happens, that's irreversible. And, or some of it could be. It depends on how badly they're damaged. But anyway, it's a risk versus benefits. To me, obviously, I'm going to be biased because I practice like you, functional medicine, and I want to do things to try to improve the health of the person. And then if their health doesn't improve, and again, they could take the medication while trying to improve their health. But once the radioactive iodine and the surgery are just so extreme, and once you get those, there's no turning back.
Yep. So on the contrary, what are some of the natural treatment options, and like what did you consider and what do you use with your patients?
Yeah, so bugleweed is one of the natural agents I took. It's an herb that has antithyroid properties. And yeah, it worked really well with me. Works, I'd say about 75% of the time
Wow.
in patients. So again, but there is that 25-30% of the time it doesn't work. And that's why if someone is taking the meds and if they're tolerating it well, I would never, I mean, I don't have prescribing rights, so I wouldn't tell anyone anyway to stop taking the meds. But even if I could, I wouldn't tell them to stop the meds, take the bugleweed, because we don't know for sure if it'll help. But if someone isn't taking anything, that's usually what I'll start them off with. I'll say, well, why don't you try taking the bugleweed since you're not taking a medication? And, if they don't want to take the meds, again, that's up to them. I will never tell them to not take it. But then there's motherwort. So motherwort also I took. It works on the cardiovascular symptoms. So I was, the bugleweed was helping, but I was still having some heart palpitations, and I took the motherwort, and that pretty much helped to eliminate the palpitations. There's lemon balm. Lemon balm has a calming effect. And so I didn't take lemon balm when I dealt with Graves. And usually when I give it, it's usually like at night, like for people having issues with sleep, although they can drink some people like to drink lemon balm tea, which is perfectly fine. L-carnitine. So L-carnitine in higher doses. So if someone's taking like 500 milligrams of L-carnitine, it's not going to have this, antithyroid properties. But research shows that taken between 2,000 and 4,000 milligrams could actually not only have antithyroid properties, but there's one study that shows it could be effective even in cases of a thyroid storm, which is really a severe case of hyperthyroidism. Now, I don't know if I would agree with that, meaning that if someone was in a thyroid storm, I would tell them to go to the ER and not to take higher doses of L-carnitine. So definitely I wouldn't try the natural approach if you have a thyroid storm. But it's interesting that it actually mentioned that in one of the journal articles. And so, the L-carnitine, lithium, has a lithium carbonate, commonly given for depression, or at least in the past, commonly given for depression. They found that it has antithyroid, makes people hypo. And so some practitioners will give lithium carbonate, but that requires a prescription. So from a natural perspective, there's lithium orotate, which isn't as potent, but that's another option. Then, getting back to the iodine. So again, I don't take this approach, but iodine, you mentioned how, if someone has low thyroid, in some cases it might make sense. Usually not, because usually it's Hashimoto's and it's autoimmune. But if someone had an iodine deficiency, then it could cause hypothyroidism. And then if you supplement with iodine, it could potentially correct that deficiency. But higher doses of iodine could also have the opposite effect. At times, it could induce hyperthyroidism, like you mentioned, but it could also sometimes suppress hyperthyroidism. So it's weird the way it works. But again, there is there's that risk associated with that. So we won't talk anymore about iodine. But those essentially are the symptom management agents that, from a natural perspective, that I'll recommend for people with hyperthyroidism.
What about green tea? I've used green tea extract in the past. Have you used that one?
To inhibit thyroid? No, I have. Okay. I have not used it to inhibit thyroid hormone.
Or what about soy? I know soy is another interesting option, but
Yeah, so I have not, so I usually recommend for people to avoid soy, even
Yeah.
those, it just for other reasons. I mean,
Yep.
I think when someone's in a better state of health, I'm not against them eating like organic fermented soy, but while they're trying to improve their health,
Mhm.
it's common allergen. And of course, a lot of it is genetically modified, but even if it's
Totally.
organic, there's other reasons. So.
Yep. Sure. Anything else you did on your journey? And like how you mentioned earlier in the podcast, there are things you do to maintain your health, to reduce Graves from coming back. So before we kind of conclude the show, are there any other things that you're doing or that you do with your patients that you didn't mention yet today?
Well, I mean, stress management was a big factor with me. So obviously I stopped the overtraining. So I still exercise, but you want to listen to your body more isn't necessarily better. And the stress management, I block out time every day for stress and for
Good
stress
for you.
management.
Yeah.
Yeah, but what's important when I say that, it's not like I'm, like I know not a lot of people, but like I remember there's one practitioner I remember hearing how every morning he blocks out like 2 hours for
Yeah.
meditation, and I
Yeah. I don't have that
definitely
kind of time.
definitely
Yeah.
don't do that. So what I usually tell people is, I try to do at least 10-15 minutes a day. So again, it's not like I'm even doing an hour a day. Sometimes I'll go longer than that and maybe like 20-30 minutes. But I tell people start with 5 minutes just to get in the routine of blocking out, just like exercise, you want to get in a
Mhm.
routine. And if someone starts with 20 minutes or even 15 minutes, they might just do it a few days a week. But I think it's important to do it on a daily basis. And then one other thing I'll mention that I think has been huge when it comes to maintaining my health is just constantly working on reducing my toxic load, just because I mentioned earlier the impact of environmental toxins, but it's difficult because we don't see them. But
Mhm.
yeah, so doing things like sauna therapy, I do that a few days, a few days per week. Definitely not a few times per day, a few days per week, infrared sauna. And then, try to do as much as I can through, diet as well. Sometimes I'll do like supplements to support detoxification as well. But yeah, the stress management, of course, eating well, reducing toxic load, and then of course sleep, trying to get
Mhm.
sufficient sleep. So those are really, big things as far as maintaining my health perspective.
Awesome. Thanks for sharing. We should go back to LDN really quick because I do use that in my autoimmune cases, and it many times, not for everybody, but in many cases, it will lower thyroid antibodies. So, what's your opinion on LDN use?
So I like LDN. The problem is, at least what I've seen, is that it's hit or miss.
Agreed.
So it doesn't
Hmm.
work with everybody. And,
Hmm.
interestingly enough, so I don't, again, I can't prescribe LDN, but I interviewed someone on my podcast who prescribes it. And he said that, he deals more with Hashimoto's patients as well, but also
Hmm.
with some Graves. But he says he doesn't see it he doesn't know why, but he doesn't see it as effective in those with Graves as with Hashimoto. So that was
Okay.
the first time I heard that. With me, I see more people with hyperthyroidism than Hashimoto, so it's hard to make that comparison. But either way,
Yep.
I think it's the challenge is when you have high thyroid hormone levels, you want them down quickly, and so
Yes.
you don't
Yep.
have time to,
Yep.
so I think it could be beneficial for someone who's under control already with the anti-thyroid meds. And then if they want to take that in combination, you just
Hmm.
got, as you know, you got to be careful because you were taking thyroid hormone or anti-thyroid meds and you're modulating the immune system, you might not need as much of the medication. So
Hmm.
you might become more hyper or hypo depending on what condition you're dealing with.
I totally agree that I haven't used it in hyperthyroidism, but in hypo, for many of my patients, again, it's hit or miss, but for the patients who it is lowering antibodies for, typically thyroid function picks up and we have to lessen their medication. So that
Yeah.
I would agree with that. All right. Well, as we wrap up the show here, tell us where listeners can find you. And I know you have a thyroid checklist. So tell us about that.
Yeah, so they could visit thyroidchecklist.com where they could pretty much in the thyroid checklist I discussed the different triggers associated with Graves Hashimoto's, a deeper dive than I did here. So if you want to find out more about the triggers of Graves and Hashimoto's, that checklist I think you'll find to be helpful. And I have also my website, Natural Endocrine Solutions, is my main website. Have hundreds of blog posts and articles related to Graves, Hashimoto's, non-autoimmune thyroid conditions as well. as well as my podcast, which I recently interviewed you as well. And so my podcast is Save My Thyroid, which I actually have a separate website for that, savemythyroid.com. But you could also just type in Save My Thyroid in Apple Podcasts or Spotify or wherever you want to listen. And then my books that you mentioned earlier, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, and Hashimoto's Triggers, both of which you could find on Amazon.
Awesome. Social media? Are you on social media?
Oh, yeah. Social media. So I have, I'm on social media, Facebook. I'm actually not on Instagram, but I'm on Facebook. I have some Facebook groups, one it's called Save Your Thyroid Facebook group, and which is actually for both Graves and Hashimoto's patients. And then I have one just specifically for hyperthyroidism. But then also YouTube. I'm on, I do have a YouTube channel, Natural Thyroid Doctor, where all the guest interviews that with the podcast, it eventually goes onto the YouTube channel. So yeah, that's eventually I'll do TikTok. Haven't done TikTok yet, and Instagram we'll see. I don't know if I'll do Instagram, but so far I've not done that.
There's still a lot of places. Yeah. Well, thank you so much for coming on the show. Oh, I got to ask your top longevity tip. I almost forgot. What's your top longevity tip?
Yeah. So, again, to listen to, as I mentioned to you in the beginning, I listened to some of the other podcast episodes. So I knew this was coming, and still it's hard to choose like one thing to, so if I had to say one, I'll go, the stress management's big, but I'll go the toxic load, the reducing your toxic load, just because it's something that, we're just like I said, constantly being bombarded with these toxins, environmental toxins. And it doesn't mean you have to do like infrared sauna. If you can, that's great. I should say infrared, if you have hyperthyroidism, you might want to be cautious while you're because that'll also raise the heart rate. So, should mention that. But you could do other things. Again, there's, eating plenty of vegetables, including cruciferous vegetables to support detoxification, as well as, supplementation. And then, of course, trying to minimize exposure, organic food, natural cleaners and cosmetics, which I mentioned earlier. So if I had to choose one, again, it is tough, and we could easily say diet or stress management, but I'll go with the reducing toxic load.
Great. I sat in my sauna last night, so I'm on my way. Well, thank you so much. This was great. Thanks for coming on the show and sharing natural ways for us to improve thyroid and really immune health. Awesome. This is great.
Yeah. Thank you so much.